welcome back to EverlastCyber. In today's video, we'll be going through Module 2 of the NACC-PSW certification exam. This module covers safety and mobility. So we'll be starting right off with question 1. What kind of fires can a multi-purpose fire extinguisher be used on? A. Class A, B, and C fires. B. Class A and B fires. C. Class A and C fires. D. Class B and C fires. Class A fires involves ordinary combustibles like paper, cloth, and wood. Class B fires involve flammable liquids or gases like oil, grease, and gasoline. Class C fires involves electrical equipment or appliances. So a multi-purpose fire extinguisher can be used on these 3 types of fires. So our answer is option A. Question 2. What does isolation precautions do? A. Prevents the spread of communicable diseases. B. Destroys pathogens and non-pathogens. C. Destroys pathogens. D. Prevents all infections. Isolation precautions are designed to prevent the spread of communicable diseases from an infected person to others. In option B, isolation precautions are primarily focused on preventing the spread of pathogens and not on destroying non-pathogens or pathogens. Non-pathogens are generally not harmful, so they are not the focus of isolation procedures. The same applies to option C. Isolation precautions helps to prevent the transmission of pathogens, but it doesn't destroy them directly. For option D, isolation precautions do not prevent all infections, but rather it limits the spread of specific infectious diseases that are communicable. So our answer here is option A. Isolation precautions involves specific practices like using personal protective equipment, isolation rooms, and proper hygiene protocols in order to minimize the risk of transmitting infectious agents. Question 3. Personal protective equipment includes A. Eye shields, aprons, masks. B. Aprons, gloves, booties. C. Masks, gloves, goggles, gowns. D. All of the above. Personal protective equipment includes a variety of items that protect healthcare workers and others from exposure to potentially harmful substances or infections. So all these options that are listed are actually personal protective equipment. So our answer is option D, all of the above. Question 4. What is the most effective infection control technique used in long-term healthcare? A. Effective hand washing. B. Utilization of a treatment mask. C. Wearing latest treatment gloves. D. Sterilization of disposable items. Effective hand washing is considered the most important and effective infection control technique in long-term healthcare facilities because proper hand hygiene helps to prevent the spread of infections by removing bacteria, viruses, and other pathogens from the hands. And these are the most common means of transmission in healthcare environments. In option B, while wearing a mask can prevent the spread of certain respiratory infections, it is not as effective as hand washing for controlling the spread of infections in the healthcare facility. Gloves are important for preventing the transmission of infections when handling bodily fluids or contaminated materials, but they should be used in conjunction with hand washing and not as a substitute. Sterilizing items is crucial for infection control, but it is more relevant for reusable medical equipment rather than for the day-to-day hand hygiene practices. So our answer here is option A, effective hand washing. Question 5. When a patient is to be transferred from the bed to the wheelchair, they should wear firm, non-skid shoes to A. Provide strength on their weak side. B. Provide a good base of support. C. Make them steadier on their feet. D. Prevent slipping or sliding on the floor. For option A, while non-skid shoes can help with stability, they don't provide strength on a patient's weak side. For option B, non-skid shoes can help with stability, however, they don't directly create a good base of support. For option C, non-skid shoes can make a patient steadier by preventing slipping, but they don't make a patient steadier on their feet in all situations. So, we'll be going with option D. When transferring a patient from the bed to a wheelchair, wearing firm non-skid shoes will help to prevent slipping or sliding, and this is important for maintaining safety and stability during the transfer. The non-skid shoes will provide traction on the floor, and it will reduce the risk of falls or accidents during movements. Question 6. When using a cane, it should be A. Held on the side the resident prefers. B. Positioned on the affected or weaker side. C. Alternated, first on one side, then the other side. D. Positioned on the unaffected or strong side. In option A, while the patient may have a preference, it is recommended that the cane be held on the unaffected or strong side for maximum stability and support. In option B, the cane should not be positioned on the affected or weaker side because doing so will not provide the necessary support for the weaker leg and it could worsen balance issues. In option C, alternating the cane from one side to the other is not recommended because it can lead to inconsistent support and destabilize the user. So, we'll be going with option D. The cane should be positioned on the strong side because it will allow the cane to provide additional support and stability, while the weaker or affected side is used to bear weight during walking. The cane should be held in the hand on the strong side to assist with balance and to reduce strain on the weaker side. Question 7. When are falls most likely to occur? A. During the evening. B. When family members are present. C. When bedside care is given. D. During the daytime. Falls are likely to occur during the evening due to factors like fatigue, reduced visibility in low lighting, and when the patient is more tired or less alert. So options B, C, D are not the correct ones. Falls don't occur when family members are present. In fact, family members may provide additional support and attention, thereby reducing the likelihood of the fall. In option C, falls can occur during bedside care, but it is not specifically the most likely time. For option D, falls are less likely during the daytime compared to the evening because during the day, the individual is more alert and lighting is better. So this occurs likely during the evenings. This is because the clients or the patients may be more prone to stumbling or misjudging distances because they are tired or the environment is not well lit. Question 8. When using proper hand washing technique, the PSW should A. Rinse with water. B. Use hot water. C. Rinse with the fingertips pointing down. D. Turn off faucets with a gloved hand. While rinsing with water is a necessary part of hand washing, the focus should be on the proper technique. Hot water is not recommended for hand washing because it can cause skin irritation. Lukewarm water is more ideal for hand washing to ensure effectiveness without damaging the skin. When using proper hand washing technique, it is important to rinse with the fingertips pointing downwards. This will help the water and soap to flow away from the hands and wrists, thereby reducing the risk of contamination. In option D, it is important to avoid using gloved hands to turn off faucets because this can lead to cross-contamination. The proper procedure is to use a paper towel to turn off the faucet after hand washing, thereby ensuring that the hands do not touch the contaminated faucet. So here our answer is option C. Rinsing with the fingertips pointing down will prevent recontamination of clean areas like the hands and the forearms, and by avoiding contact with potentially contaminated areas like the sink or faucets. Question 9. What is the first responsibility of a PSW when fire is detected? A. Alert the fire department. B. Remove the client. C. Contain the fire. D. Extinguish the fire. When a fire is detected, the first responsibility of a PSW is to remove the client in order to ensure their safety. In healthcare and caregiving settings, clients may have mobility issues or other vulnerabilities, so it is essential to prioritize their safe evacuation before taking other actions. The approach to follow is RACE: rescue first, raise an alarm, contain, and then extinguish. This is the protocol that is commonly used in healthcare facilities. So for rescue, remove anyone in immediate danger, starting with the most vulnerable. Alarm: alert the fire department and other personnel. For contain, close doors to contain the fire and prevent it from spreading. And then to extinguish, attempt to extinguish the fire if it is safe and manageable. Question 10. Muscles are attached to bones by A. Fascia, B. Tendons, C. Other muscles, D. Ligaments. Fascia is a type of connective tissue that surrounds muscles, organs, and other structures. It supports and separates muscles, but it does not directly attach muscles to bones. Tendons are strong, flexible bands of connective tissue that attach muscles to bones. So when a muscle contracts, the tendons helps to transmit the force to the bone, thereby allowing movement of the body parts. Muscles are not directly attached to other muscles for the purpose of movement. However, the muscles work in pairs or groups to allow movement. Ligaments are connective tissues that attach bones to other bones at joints, providing stability, but they do not attach muscles to bones. So our answer here is option B. Question 11. Which of the following is not considered a physical restraint? A. Walker, B. Seat belts, C. Jerry chair, D. Side rails. A walker is not considered a physical restraint because it is a mobility aid designed to assist individuals in walking safely. Seat belts, on the other hand, when used in certain chairs or wheelchairs, can act as physical restraints by restricting a person's ability to get up independently. It is used to prevent movement, so it is considered a form of restraint. The geriatric chair or Jerry chair is often used to restrict movement for individuals who may otherwise have difficulty staying seated. So this is a form of restraint. Side rails in beds are considered physical restraints when they prevent individuals from freely getting out of bed. So it limits independence and restricts movement. So out of the options, a walker is not a physical restraint because it is a mobility aid designed to assist the individuals in walking safely. Question 12. The sideline position refers to the A. Supine position, B. Prone position, C. Fowler's position, D. Lateral position. The supine position refers to lying flat on the back and facing upward. The prone position refers to lying flat on the stomach facing downwards. The Fowler position refers to semi-sitting position where the head of the bed is raised and it is typically between 45 to 60 degrees. This is used for patients with respiratory issues or who are recovering from surgery. The side-lying position is also known as a lateral position where the person lies on one side of their body, and this position is used for comfort, to improve breathing, and to prevent pressure sores. So our answer is option D. Question 13. A lift sheet will extend from the A. Head to above the knees, B. Waist to the ankles, C. Shoulders to below the knees, D. Head to below the ankles. A lift sheet is used to assist with moving or repositioning a patient in bed. It is placed under the person, extending from the shoulders to below the knees, and it is used to provide support and help transfer them smoothly without straining either the patient or the caregiver. So our answer here is option C. The lift sheet extends from the shoulder to below the knees. Question 14. We can see microorganisms with the A. Telescope, B. Human eye, C. Ophthalmoscope, D. Microscope. A telescope is used to observe distant objects in space, but not small organisms. The human eye cannot see microorganisms because they are much too small to be detected without magnification. An ophthalmoscope is used to examine the interior of the eye, but not for microorganisms. Microorganisms are too small to be seen with the human eye, so they must be viewed under a microscope, option D, in order to see them, because the microscope magnifies tiny objects and organisms. Question 15. Viruses, fungi, protozoa, and bacteria are all forms of A. Foot fungi, B. Infection control measures, C. Microorganisms, D. Plaque or tartar. Foot fungi is a specific type of fungal infection like athlete's foot, and it does not, the term does not encompass all types of microorganisms. Infection control measures refers to strategies that are used to prevent the spread of infections, not to the actual organisms that cause the infections. Viruses, fungi, protozoa, and bacteria are all types of microorganisms, and these are tiny living organisms that can only be seen under a microscope. For option D, plaque and tartar refers to a buildup on teeth caused by bacteria, but they do not include all types of microorganisms. So with respect to the question, our answer is option C. Microorganisms can exist in various environments and they may cause infection. However, not all of them are harmful. Some of them are beneficial, while others can lead to diseases in humans, animals, and plants. Question 16. Which one of the following is not a mode of bacterial transmission? A. Vector, B. Sterilization, C. Direct, D. Indirect. Vector transmission involves the spread of bacteria through carriers like insects, and these insects transfer the bacteria from one host to another. Sterilization is not a mode of bacterial transmission, rather it is a method used to kill or eliminate all forms of microorganisms, including bacteria. Direct transmission occurs when bacteria are spread through physical contact with an infected person or through touching bodily fluids. Indirect transmission happens when bacteria are spread through contact with contaminated objects or surfaces, such as medical instruments or doorknobs. So our answer here is option B. Sterilization is not a mode of bacterial transmission. It is a part of infection control to prevent the spread of bacteria and other pathogens. Question 17. When microbes have been reduced in number, which one of the following has occurred? A. Contamination. B. Outbreak. C. Disinfection. D. Sterilization. Contamination is the presence of harmful microbes on a surface. An outbreak is the occurrence of more cases of a disease than what is normally expected in a given area. Disinfection is the process of reducing the number of harmful microbes on surfaces or objects to a level that is considered safe, while sterilization is the process of completely eliminating or killing all forms of microorganisms, leaving nothing behind. With respect to the question we have, it says the microbes have been reduced in number, so this makes our answer option C, disinfection. It does not necessarily eliminate all microorganisms, but rather it reduces them to a level that can prevent infections and diseases. Question 18. Mrs. Smith has a belt restraint. How often should she be checked for the position of the restraint? A. Every hour. B. Every 30 minutes. C. Every 10 to 15 minutes. D. Every 2 hours. When a patient has a belt restraint, it is important to check them frequently to ensure that the restraint is applied properly and it does not cause harm. The position of that restraint should be checked every 10 to 15 minutes in order to ensure the patient's safety and comfort and to assess for any signs of restricted circulation or discomfort. So our answer here is option C, every 10 to 15 minutes. Question 19. Laws designed to protect employees from injuries and accidents in the workplace are covered by A. Substitute Decision Makers Act. B. Occupational Health and Safety Act. C. Regulated Health Professions. D. Health Disciplines Act. Our answer here is option B. The Occupational Health and Safety Act is designed to protect employees from injuries and accidents in the workplace. It outlines the rights and responsibilities of both employers and workers in order to ensure a safe working environment. Question 20. Which of the following is incorrect regarding the use of a cane? A. The weak leg is moved forward with the cane. B. 4-point canes provide more support than single tip. C. A cane is held on the weak side of the body. D. The grip of the cane should be level with the hip. If we take a look at all the options, option A is correct because when using a cane, the person should move the weak leg and the cane forward together, followed by the strong leg. In option B, the 4-point cane have 4 tips and this provides greater stability and support compared to a single tip cane. In option D, the cane's grip should be at hip level when standing upright, and this will ensure proper posture and effective use. So the option that is incorrect here is option C. The cane should always be held on the strong side of the body and not the weak side to provide better support and balance when walking. So option C, where it says a cane is held on the weak side of the body, is incorrect. This brings us to the end of the Module 2 video for the NACC-PSW certification exam. Don't forget to like, comment and share, and also hit the subscribe button so you'll be notified when our Module 3 video will drop. Thank you for watching, and I'll see you in the next video.